Oh God, it's coming. I mean, I'm telling you, dude, I'm right in eye shot. Oh, look at that. Oh God, I'm scared. Hold on, man. It's right in my face. It's like
I block the camera.
Oh, it's like a giant zit, man.
See that little...
Whoa, there it is. There it comes. Oh, God.
Oh, I missed you. You're fine. You're fine.
Woohoo! Oh, look at that. Good grief. This is insane. Do I look a little glassy?
A bottle of sterile water over here.
All right, you know him. It's Dr. Mike. We're at PGA Animal Clinic, and we have a couple of patients for him to see. And I wanted you to see this first on camera because it's so odd.
With shock factor.
There is Marge. You want to go grab her and then look on her plaster on. This is an interesting thing. Dr. Mike and I became friends through our friend Fred. Oh. You can see there's something going on there. I don't know if that's an organ or some kind of growth. I'd be careful. Just I mean, you know what you're doing, but it's just so odd. Like, and
how long has that been there?
A couple of months. So
did it start off as like
something small?
Yeah,
and
like
then
a
it
little
grew.
shell defect almost.
Yeah, exactly.
Okay.
So I don't know. I mean, she kept motoring along. It wasn't until obviously it was really apparent that I noticed it because. How often am I flipping her upside down, you know? Actually, it happened when she crawled up on my lap, flipped over upside down and noticed it, and then did that. So she's one of our stars, and we love her. Of course, because she came from Fred also, and she's so friendly. The friendly snapper, if you will. So I don't know what that is, man. It's bizarre.
Yeah, I mean, it's definitely a shell defect. So you basically got that lining that kind of sits inside that kind of protects the coelomic cavity.
Yep.
That's what you're seeing.
Yeah, it's prolapse.
So it's essentially like the equivalent of a hernia.
Okay, cool.
So that's a little bit tricky in the sense that, you know, really that all needs to be like cleaned up. And some kind of patch needs to be put on there.
Okay.
You know, similar to what you would do with like a, hit by car tortoise or turtle.
Okay. Have you ever messed with something?
It's been a long time since I've done any of that. So we may reach out to some local resources and see if they can kind of help get us some supplies for that, because I don't keep that kind of stuff here.
Okay, I think Bush Wildlife has done stuff like that.
They do that all the time.
I could call Dr. Heather and see if she wouldn't mind helping out.
Yeah, she would do that all the time, especially for gopher tortoises.
Right, okay.
So yeah, absolutely. I mean, for her, this would probably be no big deal at all.
All right, so it looks like the prognosis on that will be fairly good.
Yeah,
would you trim some of that tissue?
So it depends. We'll take an X-ray today just to kind of see what the shell around it looks like.
All right.
If the shell around it, if all that bone is nice and healthy, it may just be like minimal debridement in that area, kind of clean up the edges of it.
Okay.
Make sure all that tissue's healthy, get it all tucked back where you want it.
Okay.
And then put
some
sort of patch over top.
Like a fiberglass resin type tissue.
Yeah, similar. Yep.
Now, would the bone then heal, or would it would? All right.
Yeah, eventually that deficit will close.
All right, cool.
Yep.
All right,
it
Marge.
just takes a long time.
Your character. All right, let's throw her back on, and then the newest member here.
Thank you to all our loyal Patreon members out there who have helped to create an amazing reptile community online with us. This week's shout out goes to Daniel Wilflingsetter.
So I'll go ahead and show you guys. We're going to have a look at our new boa. I don't have a name for this one, so I'm open to any and all suggestions. Usually names just kind of pop out, but let's go ahead. Come here, little one. Oh, very nice snake though. Already gaining weight, which is nice. So yeah,
nice.
Handleable, by the way.
Yeah, nice boa.
Yeah, really cool. It was kind of a rescue from the Phoenix Herp Society, and they drove them all the way out here. But if you look at that tail, I had buddies going out that way, but you could see.
Oh, yeah.
So you've seen something like this before?
Yeah. I'm just going to put your front half down there.
Maybe we can
And you said, eating behavior, everything seems totally normal?
Totally normal.
Okay.
Is anything going to squirt at me?
Can't guarantee it. You want me to aim it towards you?
Don't aim it towards me, man. I don't want snake scent on me.
Well, that's exactly what I'm checking here.
What do we got there? Boy, or
I'm just checking to see
if anything oozes.
Yeah. So sometimes they will get scent gland infections. Sometimes it's just one side. Sometimes it's both. Sometimes it's
crazy.
kind of the tail side of the cloaca is most common. I've seen they've got paired scent glands. I've seen it up here too.
Okay.
You know, and usually, if that's the case, you know, if that's what's going on, you've actually got to drain those and like flush them. It's a little bit of a process, but
gotcha.
It's awfully uniform swelling here, so.
Where would the if it was? Do we know if it's a male or female? Can you? You don't know yet. Right?
I can probe it though.
Yeah, I'd like to know.
I'm not. I very rarely sex these guys, honestly. All right.
Is there
All right. What I'm gonna do? I'm gonna get a couple probes.
Okay.
And just kind of really gently probe around the opening there of each gland, and then we'll kind of see how things look then. Obviously, you can see on here, you know, it's like when I'm just putting gentle pressure. I mean, you can see this side kind of protrudes pretty easily, whereas the other, I'm putting a fair bit of pressure, and it's really not. So we're just going to kind of check things out here, see what happens.
I love it.
All right.
This is fun. I get to learn. And you're just checking the rest of the body?
Yeah, I'm just gonna do a good once over here.
What are you trying to feel for?
I'm just making sure I don't feel any, you know, obvious abnormalities, you know, just palpating down, you know, anything that would be concerning with, you know, a tumor or anything like that. Not that I would expect it, certainly, but I just want to take a good look in the mouth. Awesome. Hey Taylor, can you hand me a tongue depressor?
How, you know, in vet school, did you get a lot of hands-on with reptiles, or was this mostly, you know, what you kind of did?
Yeah, I mean, if you certainly can, it depends what school you go to so far as the programs that they have, you know, if they've got a really good zoo med program. I did, you know, a rotation, so a 3-week rotation. I actually did 2 3-week rotations at University of Georgia.
Okay.
Because the zoo med specialists there, Dr. Divers and Dr. Mayer, are phenomenal. So I really wanted to go there. And I did my clinical year at Purdue, and they didn't have zoo med up there. So I don't know if they do now, but they didn't when I was there. And
gotcha.
And so they kind of farmed me out and let me go down there. So
cool.
Oral cavity looks great.
Oh, that's
Glottis looks nice and clear.
Cool.
I'm just gonna kind of attempt.
Yeah,
to
understood.
here.
And again, you're just feeling for any kind of abnormality.
Yeah, I mean, basically, you're just making sure you don't feel any obvious, you know, on the top side, any obvious, you know,
like fractures,
rib fractures, you know, spinal issues, anything like that. When you're palpating the coelomic cavity, you're really just trying to make sure you don't feel anything that would be worrisome for like a tumor or
gotcha.
You know, anything like that.
Awesome.
Yes, pretty darn well behaved, Bo.
And congratulations, Arnolder, man. You're a dad again. So you got
again.
A boy and a girl.
Yep.
That's
one
it.
Of each.
You're
That's
done.
It.
Yeah. 1.1. You're good, man.
Yep, exactly.
And she's being very good.
Yeah.
That's awesome. I'm always impressed with veterinarians because, you know, you have to know so many different bodies and classes of animal. It's not like the human body, which, you know, even with one species, it can be tricky because every body is different.
Yep.
But when you really have different bodies, I mean, you go from a snake to a quadruped to hoofstock, you know, I mean, it's like, holy smoke, dude.
Yeah, you learn about a lot of different animals, that's for sure.
Yeah. Awesome. Well, so many of our viewers have goals to potentially be working in the animal world and actually working as a veterinarian. So that's why I asked all the questions of you, bud.
No, it's a very, very rewarding field for sure. All right, well, I'm going to get a couple probes and
we're gonna probe
check
away.
that area out. And
let's do it.
See what's going on, see what we find.
All righty. Fun. We're going to probe a snake's cloaca. I always liken this to like when you get abducted by aliens and they start probing you. That's probably what the snake feels like. Not that that's happened to me. But anyway, yeah, I'm stoked to get this all figured out. But the cool thing is Dr. Mike also does, of course, cats and dogs and sees all kinds of breeds. And he's a snake lover. You guys remember when I went to Palm Beach Colubrids and Went over there, awesome facility. Dr. Mike is involved in that as well. And yeah, love snakes and reptiles, so I got lucky. Once again, another great thing Fred did for me was introduce me to Dr. Mike. So without his support, it's very difficult to be able to treat all these animals. So that's what we're doing. Getting some of the tools of the trade ready here. Some probes. And I guess he's going to get in there and figure things out. All with a beautiful sound of, oh, that's sad. You don't like it.
Dim it a little bit.
You're dim it. Yeah, dead in the noise. Oh my gosh. You ready for him?
Yeah.
Her, him. I would love to know. I'm hoping a female, but I'm happy if it's a boy. It don't matter. But I love. Oh, hello there. Sorry about that.
That's okay.
Yeah, I just like females because they get large.
Yeah.
And the whole reason I wanted to get a boa again is because with Florida, you don't have the drama of the conditional species permitting. Ooh, I got a little KY on me, I think.
Yes, you did.
It's a slippy creature. And you still have an impressive animal in a boa constrictor, you know, without all the regulations. The biggest regulation being I want this animal to be able to be outside at some point, you know?
Yeah.
I'm gonna try and assist. Okay. So today's a busy day for you, man.
A little bit.
Yeah, stoked. Thanks for doing this.
Yeah, of course. Yeah, Thursdays are a little crazy around here.
She's getting a little bit livelier. I don't want anything in my butt, she's saying.
Just gonna kind of gently run this along here.
You got it. And with the probe, what are you feeling for, or what are you trying to ascertain?
So what I'm gonna do here is see if I can get into that gland opening, and then see, see if we can kind of get that cleaned out and see if it is a scent gland issue or not.
Okay. Will there be any kind of like necrotic tissue or something?
No. I mean, usually you'll just get really, really thick. Discharge.
Okay.
Sometimes it's, kind of...
Oops, sorry, like a pus.
Yeah, exactly. And pus in reptiles is very, very thick. It's like cheesy. That's why most abscesses in reptiles are surgical cases. You don't just put them on antibiotics and hope they get better.
Gotcha.
Because that's not really a thing for these guys. You've pretty much always got to cut them open, basically. Let's see.
I microchipped it. Oh, you did? Oh, you did? Oh, yeah.
And sometimes if you can't go this route, sometimes we'll put a needle in there.
Okay. And try and
go from the side. Yeah, exactly. Okay. See what we get. And I can probe it after this to check the sex too.
Thanks.
A 15? Sure. I can change it later if you want.
This side actually does not look bad here.
How much propofol did you get?
Sorry.
No worries, man. You're doing great. You do what you do. I'll worry about there's something.
Yeah, just a little tiny bit of debris there. Nothing rewarding.
Gotcha. Strange. Are those the scent glands?
Yeah, it looks like this is the opening here. So they've got an opening on each side.
Okay.
And sometimes you're able to just pop right in there, and
gotcha.
There's just a little plug that's kind of stopping them from draining.
Oh, I see.
Other times it's.
I'm telling you, dude, I'm right in eye shot of this. If there's a lot of pressure built up there, I hope you got a good face wash here.
Yep.
Thanks, because it's gonna be gross. Unless, you know, it's a male and the scent attracts females, then Kate's gonna be so stoked later. I might leave it on.
She would love that.
She'd love my snake musk.
It's a great odor.
Yeah, she wasn't happy to find out there was a snake in the office. She was not thrilled. But you know, she handles things well, my wife. But this snake's handling things well too, to be perfectly honest. I mean, there's been no attempts to bite or anything, so it's a very agreeable critter.
It's a champ.
Yeah.
I'm gonna try and aspirate.
All right, man. I'm gonna try and continue to hold this thing.
Just see.
Oh shit! Sorry. We need Tom. I need Tom here, my partner in crime. Oh my gosh.
All right.
Phew, God, I just wanted to bear down. All right, I'm trying to hold it. Oh, look at that! Oh God, I'm scared. Hold on, man.
It's okay.
It's right in my face,
You're
Doc.
good.
Oh my God.
Oh, okay. That little plug on that side at least got us something here.
Okay. It's like a
Here,
giant.
I'll
Thanks.
guard you,
It's
but
like
then
a,
I block the camera.
Oh, man, it's like a giant zit, man. I'll take one. I'll take one for knowledge, for science here.
Let's see.
Oh crap! I'm shutting my eyes.
Yeah, I don't blame you.
I need one of those face shields that people wore during COVID. Blah, blah. No, actually, I don't get that grossed out, but
This one doesn't really smell all that bad.
no,
either.
it doesn't smell that bad. Actually, bottle some of that up, like I said, man.
Yeah.
You could smell it though.
Oh yeah. And you can see now, see that little.
Whoa, there it is. See, you got it. You got it. Get that
you're
thing
welcome.
over.
You're welcome.
Come on, man. I knew there was pressure built up in that plumbing. Holy smokes. Whew.
Yeah, and that's, this stuff gets real thick.
Yep.
So
if it's not
that's why if
expressed,
they're not able to kind of pass that,
oh God, it's coming.
then it all just builds up in there.
That's an incredible stench. It's getting worse.
When they're badly abscessed, it's a nasty smell.
Whoa.
Much, much worse than that.
Whoa. I'll tell you what. This is like some smelling salts right now. Whew. You guys, trust me. This is interesting.
And what I'm gonna do here, once I get a little bit more of this going, I've got a little curved tip syringe there.
You
we'll put some sterile water in.
Okay.
And then we'll just
try and flush it.
Yep, exactly. Flush all this out.
Oh my God.
Just wanted to try one more time before I.
Oh yeah, please do. Oh,
there,
please do. I'm so happy that we were successful here, or you were rather.
Team effort.
Oh yeah. Smelly snake around my neck. I feel I'm in a very vulnerable position. If I don't get the stench, she's gonna bite my neck. Whew, that's an odor. That's something I don't know if you guys have ever smelled, but trust me, that's something. That's burning my nose hairs out. You barely flinched, man. Oh God.
I'm used to it. But you can see how small that opening is,
Right. So it's just been building up. Now, what will they do with these scent glands? They don't mark territory, do they? It's just like a pheromone?
It's kind of like a defensive mechanism, too.
Oh, really?
It's like if you pick up like an angry
a garter
little
snake or something.
Yeah, exactly.
If you smell bad, you're not good to eat.
Exactly. A lot of the colubrids will do that. They'll kind of shake their tail and throw a nice foul odor around.
Well, here comes some of that there.
There we go.
There comes. Oh God! Oh,
I missed you. You're fine. You're fine.
Woohoo! I got a chiropractor appointment later. Oh!
Now we're talking.
Yeah. Oh, look at that! Good grief! Oh, this is something. Oh my God! What in the You're making the mess, bud.
Yep.
Holy smokes. Yeah, I don't get queasy.
That was a good one.
That was good. I don't get queasy. It's the smell. That looks like a Play-Doh fun factory of stench. This is insane. Oh, wow. That was but so satisfying at the same time, right?
Yeah.
Because imagine the pressure on this animal.
Oh yeah, I mean just the relief from having those glands expressed usually is substantial.
Oh, wow. Sorry if I got a little overexcited, friends, but I feel so good for you. Oh my God, I feel awesome for this snake.
Turn that tail over again if
All right.
possible.
Yeah.
Here, I'm gonna. Yep.
Sorry.
That's okay. That's perfect. All right.
Holy.
Taking another look here. I mean, you can see it's
Substantially
already better.
Wow.
And a lot of that swelling just takes a little bit of time. We'll get a little anti-inflammatory on board here too for a couple of minutes just to have a little bit of pain control too, just for
So do you think
discomfort from the gland. Yeah. Shouldn't be like really painful, but I mean, imagine having your rear end pushed on like that. You want?
Oh yeah. Oops, sorry, buddy.
Oh, that's okay.
Hi, what's happening? You want to see what all the excitement's about?
I was gonna say, can you smell it?
You should see it. It's all over the floor here.
And look at this.
Look at
actually, this is a good one.
The excitement around
Look at
the
that.
winner. Oh.
Look at that, huh? I bring out the good stuff.
Yeah.
I bring the fun here. Oh boy.
It's interesting because the right side was definitely more full,
Okay.
but the left side is actually harder to express.
Okay,
So that's the one that will
Irrigate.
we'll really try hard to get that little curved tip in there. It's can be tricky because because the opening, even though it's a big snake, it's very small. So
Wow.
but honestly, that right side, I'm pretty pleased with how that came out.
Yeah, I'd say.
Much better.
Cool, man. Oh, that was great. I like results. Doc, you get results. You don't give up on scent glands. I'll tell you that much. You guys are looking to have your scent glands expressed. Dr. Mike's got the touch. I don't like where you're aiming at. He didn't like that comment. He's aiming that thing at me. Oh boy.
All right. I think we're about at the point we're just gonna kind of try and work that little curve tip in there.
Hey, 20 minutes.
Hey,
20
Casey,
minutes
are you
of
over there?
excitement.
Would you by chance
Do I
be
look a little
able to
glassy?
throw a bottle of sterile water over here?
I'm a little wobbly. I'm just playing it up.
Thank
but
you so
It
much.
is gross. I won't say that much.
Oh.
Oh, there's more.
Oh,
How you doing?
Hi.
Welcome to our
Yeah, thank you.
Do you want one that you can
nightmare.
Yeah, actually, that would be great. Thanks.
Wow, that's good. Still going.
Phew. All right.
What you guys don't know is he makes me clean up everything.
Yeah,
That's my job.
that's Kenan's fee.
That's how I pay
Yep.
pay back.
That's your fee. You get to clean all.
I'm the janitor later. Happily do it. That's so cool. I'm just happy that the animal's going to have some relief.
Yeah, I mean, you can already see. I mean, before when I put that pressure, it was very, very prominent. I mean, it was really, really bulging there. Now I have to put a lot of pressure to get that like that.
And so the rest of the swelling is most likely just tissue inflammation?
Yeah. Yeah, and that'll subside.
There we go. Yeah, this is better than Dr. Pimple Popper, I got to tell you. You watch Dr. Pimple Popper.
Look at this.
I want to get reactions.
Oh my god.
Yeah, there you go.
That's-
See that, Brandy? Oh, that's
excessive.
interesting, all right. We're going to bottle that up, and let me tell you, if you're a female snake out there, or male, I don't know, depending on the sex here,
Yeah.
that's going to be, well, actually, or if you want to ward off anyone, I can see how that would be dissuading,
Yeah.
Poor thing.
Yeah.
Okay, you can now pour this.
Thank you so much.
You're welcome. It's open.
Okay. All right.
Great. All right. Jokes are just flowing here today, huh? I'm a punny guy. Let's see what else we got here. I don't think I did any puns, though, to be honest. Excuse that last comment. Wild. All right, here's our irrigation. That's so kind of you to lubricate,
Yeah.
you know?
Yeah, gotta be nice.
Yeah.
So I do, usually you just put a little pressure,
Okay.
and then
You see
you
where
can
the opening
see it
is.
easily when you are able to express it. Problem is, it's tight quarters in here. Now this, you
I know. We're gonna get. Just
Yeah,
do your
let-
thing. I don't care. I can.
here,
I know what's coming.
Yeah, let's hold her over this. Maybe we'll
I know what's coming, man.
maybe we'll avoid further mess here.
Ooh.
like the smaller ones better. Do you? I wasn't sure. They don't bleed as much.
Let's see here. Oh,
Hello. Oh wow.
yeah, there we go.
Sorry, I have to re-grab.
Oh, that's okay.
I'm like this. There's got to be some kind of YouTube award for like getting the shot when you're one-handed holding a boa constrictor. Oh, great, Scott.
Yeah, sometimes if you can just even just get a little bit of a flush in there,
Right.
just to kind of free up a plug.
Right, there might be more hard stuff in there.
Right.
I'm gonna take the camera and I'm gonna do a tripod situation. We'll just be conscious of that, and then I can properly hold this thing.
Sorry.
It's all right. I can hold this thing better for you. Just if you can, let's do it in front.
Yeah.
Best you can.
Yep.
Thanks. Oh, easy, girl. I'm sorry. I grabbed a little too close to your neck. I know.
Move this out of here. All right.
Don't slip and fall on the
Yeah.
musk.
This snake's being so
Oh my
so
God,
good
so
for this,
good.
but you know it's still kind of challenging just to maintain a good hold, you know.
Right.
And in really bad scent gland infections or abscesses, we'll have them sedated.
Oh, okay.
So a lot of times we'll sedate them, do a little local anesthetic to kind of numb an area up and make a little incision in the side. Yeah, it's tough. I'm not really getting in there, but I think I'm putting enough pressure there from the opening. At least we've cleared some of that. And one of my daughter's favorite things to ask me at dinner when she's asking how my day was,
Uh-huh.
Dad, did you fix any big turtles today?
Oh, really?
Yeah, because
She's loving
she
turtles.
loves seeing it.
Well, we got to get her back out to the camp, and she's a little bit older now.
Yeah. Now she's over 3. I told her we're gonna go visit you, and I said we'll get to see
Guaco?
Yeah, Guaco, exactly like she said, Guaco.
That's awesome. Still a little bit more.
I think we're
At the end here?
pretty close to it. Yeah.
Wild.
We don't want to really push any harder than I'm pushing now. So
Gotcha.
we should. Yeah, sorry. Just
No, it's okay.
turning away here.
It is
But,
what it is.
Um,
I think people will understand after the first 20 minutes. They know what they're in for. You know what I mean?
Yep. All right. Yeah, I think we're gonna call it here.
Okay.
Should be good. Just that little flush freed a bunch more up. And what we'll do, we'll just, like I said, we'll do a couple days of an anti-inflammatory just for a little comfort, kind of like you or I taking some Advil.
Gotcha.
And then
That's
and then we'll recheck in a couple weeks.
Right.
Just to kind of see how things are looking and see if they're easier to express, but and you can see just from wiping, I mean, this mucosal tissue, all this tissue underneath the skin, it's starting to get a little irritated, so we're gonna give a break here. All right.
Cool.
Well, that's a nice way to
Holy
start
smokes.
the morning.
Definitely. That'll wake you up.
But yeah, I mean, you can see much better.
Definitely.
Still real puffy hair, but
Yep.
I mean that should subside, relatively quickly.
Awesome.
Yeah,
All right.
Yeah, and then I would say since we just violated for quite a while here, we'll when we recheck, I'll probe.
Okay,
and
yeah,
see
we'll
the
hold
sex.
off. All right,
Yeah.
very good.
All right.
All right, there you go, everybody. So we've got some work to do. I got to start cleaning up scent, and overall though, the snake's in good shape, and we've just figured out that this snake is extremely patient with us. So that's amazing, and I'm appreciative of that. Are you not a snake fan? Okay, there you go. All right, well, we'll keep you away.
Taylor's great with tortoises, though.
Oh, yeah, everyone loves tortoises. All right, well, a big thank you to Dr. Mike Gillen here at PGA Animal Clinic. If you live in South Florida, Central Florida, or anywhere that you can get to, if you don't have a exotic animal vet, Doc will see you, as well as seeing your domesticated animals. So definitely give him a follow, and also follow Palm Beach Colubrids if you want to see some of the other projects that Doc's involved in as his hobby. In the meantime, I'm gonna shove off here right now with our friend who still does not have a name, so leave a name in the comments below, and if I like it, I'll use it. Thanks, Doc.
You're welcome.
All right, we're gonna put her away and let her kind of chill out. Don't forget to go to patreon.com/Kamp Kenan if you want to see more behind the scenes action from our daily adventures. And that is that. See ya.